we are discussing about accessibility and affordability of people for secondary and tertiary healthcare. In India, we have health infrastructure, we have healthcare workforce, but it has been pointed time and again that the enough allocation of financial resources for our healthcare has not been the best in the world. And it is actually low at around 1.5% of our GDP. In India, we also discuss that health is a state subject. It is on concurrent list of the Government of India, where Government of India only provides assistance to various states for the health of its citizens. Now, when we talk of primary health care, it has been taken care to large extent with the deliveries in the hospital or healthcare environment. But when it comes to secondary and tertiary healthcare, then there is a huge issue of accessibility, and even before accessibility, the availability of these facilities. And there is a huge unorganized healthcare sector with small hospitals, small nursing homes. Then in urban areas, there are corporate hospitals, so-called private hospitals, big private hospitals. And then there is a whole lot of public healthcare system, both funded by the central government and also by the state governments. Now, there is a common phrase which we keep hearing that 80% of India's healthcare is in private sector, 20% is in public sector, funded by the governments, various governments. But then what we see that this 80% private healthcare is accessed by only 10 to 20% of our population who can afford it. While the remaining 20%, which is available in public healthcare sector, is accessed by majority population in India because they cannot afford. They do not have a private insurance. They are not under any insurance cover. And that poses huge problem for accessibility and affordability. And that needs to be tackled. Now in India, there has been growth of private medical college hospitals, private hospitals in urban and semi-urban areas. There is a whole lot of rural population, and it is also said that because of health, large number of people go under debt because of the health issues and expenditure on health, out-of-pocket expenses on health. So how do we make the healthcare more accessible and affordable? Naturally, the government of India has brought about Ayushman Bharat scheme, which has helped large number of people, but still it is not enough. Various state governments have come out with insurance schemes. They are helping, but again, it's standardized, uniform availability of tertiary care and secondary care in specialties and super specialties is far from satisfactory. The reason being, the most public tertiary care hospitals are flocked by large number of people who cannot afford private health care. On the other hand, it will take 622 medical college hospitals, and each hospital is at least 700 to 900 bedded hospital. But if we look at the bed occupancy of these healthcare facilities, it's far from more than 30 to 40% in real sense. Similarly, if we look at urban corporate sector or private hospitals, every hospital needs more patients, surgical patients, whether it belongs to cardiovascular diseases, neurosurgical diseases, cancer, and others. So what we need today is reinvesting this infrastructure, existing infrastructure, so that the patients can benefit. The hospitals, those who are providing private healthcare, can be reimbursed optimally for their services which are being provided in these hospitals, so that the patients are benefited at the end of the day. Because when we talk of the triangle, it is the patient, the healthcare facilities, and the system. So we need to build a kind of system where The overburdened public healthcare system is decongested, and the patients are distributed amongst those private healthcare facilities where all the facilities are available under one roof for cancer care, for cardiovascular care, for neurosurgical care, or so on and so forth. And that is something is a problem as well as a solution to this problem. And that is what we have discussed today in the BMJ roundtable. And I am sure enough attention would be given to this aspect of utilizing the available resources in the country. We talk about beds. India is very much low on the ratio per 100,000 population. There's a 0.5 per 100,000 population. Various urban towns have some, like Pune has 3.5 per 100,000, which is okay. The Delhi has 2.7, and somewhere it is 3. And if we take in totality, it is 0.5 per 100,000. But my take is that, are we utilizing our available resources optimally? And that is where challenge lies. So let's do that and then relook at the whole infrastructure, the manpower, and also the quality of care, which is a huge issue today. Even if those who can't afford, they want quality health care. So what I say, it's the reasonable health care provided to everyone who needs it at a reasonable cost. If the patient can't afford, somebody has to reimburse, whether it's the state government, whether it's the central government, whether it is some other mechanism, insurance mechanism, and that is what we need to think about. Thank you.